Welcome to Sarnia-Lambton, a region where the past and present converge to tell the stories of vibrant Indigenous communities. This land, home to Aamjiwnaang First Nation, Kettle and Stony Point First Nation, and Walpole Island First Nation, carries the legacy of resilience and tradition.
Aamjiwnaang means at the spawning stream. It reflects our people's deep connection to the waters and land that sustain us. The teachings of our ancestors continue to guide how we live and thrive on these lands today.
Walpole Island, or Bikejunang, meaning where the waters divide, is a place of incredible ecological and cultural significance. Our traditions are deeply connected to the land and the waters that have nurtured our people for generations.
Kettle and Stony Point First Nation has its own unique history, struggles, and strengths that have enforced the reclamation of our culture paradigms. The struggle to protect our lands and resources for the health of our future generations has shaped our resilience, and this continues to guide us today.
The history of Indigenous peoples in Canada is marked by resilience and adversity. Policies like the Indian Act and the residential school system disrupted lives and traditions, leaving intergenerational impacts on health and well-being. The 60s scoop further fractured families, and systematic racism in healthcare created barriers that persist today. These historical injustices are crucial to understanding health disparities faced by Indigenous communities.
Today, Indigenous communities face significant health challenges, including higher rates of chronic diseases and barriers to healthcare access. These challenges are compounded by the social determinants of health.
Poverty, housing insecurity, limited access to clean water, and education gaps contribute to the disparities that we see. Addressing these determinants is essential to creating equitable healthcare systems.
Through partnerships like the Sarnia-Lambton Ontario Health Team, we're working to bridge these gaps by integrating culturally safe practices into healthcare delivery.
We have a safe place to come to smudge, to talk, and so it's really growing, and we also help provide traditional medicines here. So being in a hospital setting, we're trying to figure out, well, how do we get you your traditional medicines, and then having them made and then brought to them.
Recognizing and respecting traditional or original knowledge is not about replacing Western medicine, but creating a space where both can exist together to benefit patients.
These approaches honor the whole person, spiritually, emotionally, mentally, and physically, ensuring that care is both comprehensive and culturally connected.
You know, the traditional Western medical care system and also Indigenous health and wellness, traditional culture, teachings, etc., can blend quite well together so that it can enhance the quality of life for Indigenous people.
I do feel that, we are supported as navigators to support our families and patients in a culturally relevant way. And I think that our community members are seeing that. And so they do trust us enough to call us and say, hey, we're coming in.
We service the urban Indigenous population. We offer children's programming, we offer youth programming. We also offer LLC programming, which is for our elderly or adults with lifelong disabilities. We want our people to be socialized and embedded with our cultural teachings to create a safe space, as well as the help with services that they're looking for, that we can help navigate them to, or maybe provide ourselves.
We have over 100 volunteers and we have 60 locations. We don't just use our resources, we collaborate with each other to maximize resources in rural and First Nation areas. It's critical to sustain services outside of urban hubs.
Healthcare providers have an essential role in reconciliation. By learning about Indigenous cultures and histories, they can provide care that respects and values Indigenous ways of being.
Education is a powerful tool. For Kettle and Stony Point First Nation, reclaiming our history and protecting our land remains central to building a strong, connected future.
Reconciliation requires action. Working collaboratively to create systems that honor and uplift every voice, ensuring that health equity is not just an ideal, but a reality.
Together, we can honor the past, empower the present, and build a future that celebrates the richness of Indigenous cultures and traditions. The journey begins with knowledge.